Hi guys, it's Dr. John Kirk from the St. Helena Women's Health Center. I'm back. We're talking about fireballs of the Eucharist. No, wait. We're talking about fibroids of the uterus. That's right. Uterine fibroids, very, very common. The technical term is leiomyomata. We don't have to use that anymore. Fibroids are so common that probably 80% of women, by the time they will pass away, will have them in their uterus. Clearly, most women aren't affected by those fibroids, and that's a good thing. What are fibroids? Well, they're tumors of the uterus in most cases. They're clonal tumors. They start as a single cell and they actually clone themselves. Identical DNA, each and every cell is just like the other one, and they keep growing almost like an onion. So they keep growing concentric circles, and when you look at it, it looks like an onion, honestly, and they kind of come out like an onion or like a little softball sometimes. They can become huge and they can stay very small. So most fibroids are going to be 2, 3, 4 centimeters in size, about an inch and a half. Sometimes they can get as big as 20, 30, 40 centimeters, as big as a full-term pregnancy, imagine. They can weigh multiple pounds. You can actually lose weight by just taking out the fibroids. But most people don't need to have anything done when they have fibroids. That's the good news. But what happens, and who does it happen to? Well, about 25% of women will have symptoms associated with their fibroids. Those are the ones that we're typically going to know about early on. And they grow whenever they start, probably in the late teens to early 20s. We don't even think about them in most cases at that early age. But as you get into the 30s and the 40s, they continue to grow. And so at some point, they get large enough to become symptomatic. Well, what do? They cause numbers of different kinds of problems. Bleeding is the most common problem. Bleeding with more painful periods that maybe don't stop as quickly as they should because the muscles of the uterus can't stop, they can't clamp down. And in that process, because these little fibroids are stuck in between the muscles that are supposed to be clamping down and stopping the bleeding during your periods, they are in the way. And so if they're in the way and it's not clamping down, you're going to bleed heavier. You're going to have blood clots. You're going to have maybe longer periods of bleeding. And that's the most common side effect, if you will, or symptom from fibroids. If they get very big, they can cause pressure symptoms on the bladder, for example, or even into the rectum. Sometimes they get so big they actually can impinge upon the various structures in the body, causing serious concerns, but that's less common. One of the other problems is they cause infertility, and particularly if they're found inside the cavity of the uterus, the place where babies grow, they can interfere with the implantation or the start of a pregnancy. And if the pregnancy doesn't implant, it won't continue. So sometimes those actually have to be removed surgically. But importantly, there are many, many different ways to manage fibroids. As I said, most people, they don't have any worries, no symptoms, nothing that really needs to be done at all. In fact, we don't even know a lot of the patients who have fibroids. But those that do, we can treat them in many, many different ways. It doesn't require a hysterectomy. Believe it or not, it's the #1 reason women have hysterectomies. But in many cases, you can avoid a hysterectomy by doing another process, another option. Sometimes it involves surgery, and sometimes it doesn't. Well, one of the simple things is to keep the estrogen levels down. Estrogen is like fertilizer for fibroids, we think of. If you don't have estrogen, for example, you're menopausal and your estrogen levels are very, very low, it's very uncommon for fibroids to grow. In most cases, fibroids start to shrink. They don't necessarily go away completely, but they are unlikely to cause problems after menopause unless they're already so big that they're causing pressure symptoms, in which case it would be sensible, probably, to remove that pressure symptom by removing the fibroids or the uterus. But as I said, there are many different options. So one can remove just the fibroids. That's called a myomectomy. And in the old days, a myomectomy was a big surgical procedure where, like a C-section or cesarean section, scar was made in the lower abdomen, and the fibroids were found, they were removed, and then everything was sewed up, and you were closed up, and you recovered for 3 or 4 days in the hospital. You went home, and then, 6 weeks later, you were back at work, and everything was fine. Nowadays, we do that same type of a procedure laparoscopically. We approach it with mini incisions, maybe 1/2 of a centimeter, plus or minus 1/2 centimeter, with as little as 1 incision at times, and as many as 3 or 4 or 5 incisions, depending on how many you have. We can actually go in and remove these fibroids through various new technologies that allow us that easy access and safe access. People go home the same day in many cases from those types of surgeries. So very different than the past. There are other ways that don't even involve real surgery, so to speak. There is what's called a uterine artery embolization. Uterine artery embolization is something that's been around for a number of years. It used to be used solely to save people's lives when they were bleeding too heavily from the uterus after childbirth. We could put these special pellets inside the blood vessels, blocking the flow of blood to the uterus, but not to anywhere else. And that would actually cause the fibroids, well, cause bleeding to stop, but it would also cause the fibroids to shrink because they weren't getting any blood, so they basically died. That process is still done today, and it's been finely tuned so that we can really focus on specific areas within the uterus, specific parts of the uterus, and specific fibroids at times. It's not without risk. All procedures have risk, but it's a very minimally invasive approach that you might want to consider if these things are bothering you. What else? Well, believe it or not, there's MRI-guided ultrasound shrinkage of the fibroids. There's radio frequency shrinkage of fibroids. Any technology that we've come out with, we try to apply it. Even cryoablation, which is freezing the fibroids. All of these things, radio frequency is simply a heating element that actually increases the temperature and thus destroys the fibroids. So we have all these new technologies, increasing safety profiles with many other technologies that help you avoid a hysterectomy where appropriate and get back to your normal life. And we want to help you as much as we can, but we can only do that if you let us know at the St. Helena Women's Health Center. Thank you so much for joining us today, and have a blessed day.